Hi, good afternoon, everyone. It's great to have so many of you joining us today. For those of you who don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the ThriveKY campaign. We're excited to be hosting our quarterly forum with the Cabinet for Health and Family Services today, and it comes one day after the kickoff of open enrollment and the relaunch of Connect, a very long-awaited relaunch. So we're going to be learning more about that this afternoon. And I just saw the good news, I think yesterday, that basically every adult is now eligible for a booster shot. And the first dose of the COVID vaccine for 5 to 11-year-olds should be arriving in Kentucky soon. So we didn't have this on our agenda, but Dr. White was gracious enough to offer to give us a quick update before we dive into some of our other topics. We really appreciate that the leaders from the Cabinet for Health and Family Services have taken the time to join us for this discussion. And on our call today, we have Deputy Secretary Carrie Banahan, Medicaid Commissioner Lisa Lee, DCBS Deputy Commissioner Lisa Dennis, DPH Deputy Commissioner Dr. Connie White, Director of the Division of Family Support Jason Dunn, and Director of the Division of Child Care Sarah Vanover. So thank you all for being here. And as always, our goal with these forums is to create more open dialogue between the cabinet, leadership, consumers, and advocates. And we really want these forums to be an opportunity for you to get the latest updates on the state's response to COVID-19, hear updates about our safety net programs, share feedback, ask questions. And why don't we advance this slide, Kelly? I know that most of you join us every month and are probably very familiar with this by now, but for anyone who might be joining us for the first time, our core purpose is to meet the basic needs of every Kentuckian through systemic change. And this is because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. And for that reason, we strongly believe that the only way Kentuckians can thrive is through anti-racist and anti-poverty policies that will lead to a more equitable and just Commonwealth. So you can see our shared principles on this slide. And if we go to the next slide, these are the members of our campaign. We can go one more slide, Kelly. Here's the agenda that we're going to be covering this afternoon. We'll start by giving our guests from the cabinet the floor to share any updates or information that they'd like advocates and consumers to know. We'll follow that with some discussions and questions moderated by our Thrive Kentucky partners. And then during each of these sections, just feel free to put questions or comments that you have in the chat. We'll try to address those as we go. We find that that works best. And if you have more questions than we can get to in the next 90 minutes, we'll just be sure to send out some written answers and a follow-up. So before we begin, some quick housekeeping. We have a lot of folks on the webinar today, so please be sure to mute your line. We're also recording this webinar and we'll send it out, the recording out with any materials, along with an evaluation and a follow-up email, so you can watch for that tomorrow. And if you are a certified community health worker or a licensed social worker and you'd like to receive CEUs for attending today, please email Kelly. She can put her email address in the chat. And with that, I'm going to turn it over to Dr. White to give us a quick update on vaccines.
Oh, thanks so much, Emily. I really appreciate it. I want to just show you, oh, it says I can't share my screen. I want to do a little bit of a change to what, there we got it, thank you, to what Emily said. Not every adult can get a booster, but most every adult can get a booster at this particular point in time. Here is the kycovid19.ky.gov website that you've heard us talk about 1,000 times. And I think what happens is people see that and then they don't see anything else. So I would encourage you to go up across the top here. And I'm not going to do this too fast because I don't want to get people seasick, but this is the home page. If you go over to vaccine and click on that, there's a wealth of information on this page. This tells you if you want to get a shot, where you can go to Kentucky, to the vaccines.gov. So I'm over 18, I want a Moderna, and I don't want to drive more than 25 miles, and I live in Frankfort. And if I tap on that, it's going to show me every place within 25 miles of Frankfurt that has Moderna. And if I say I want to go to Kroger's because they have appointments available, and I tap on that, then it tells me the phone number. It tells me I can make an appointment right here. And trust me, I was able to do this, and I am tech unsavvy. So I was able to get one of my injections from Kroger. The other thing I wanted you to see on this, which I thought was great, is this free ride offer. So if I tap on that, it tells me that some folks can get a free ride from Lyft, and that's a service that's offered with the COVID vaccine. So very excited about that. I also want to show you on this, if you go down to the dashboard and click on the dashboard, it will show you a map of Kentucky, and it'll show you how many people are in Kentucky. The population has been vaccinated. That's 57% of the whole state. But if you look at people over 18, we have 69% of the state is vaccinated, and 90% of the people, all of us smart people over 65 years of age, said, I think I'm going to get this vaccine because this stuff is killing people. So this is a way that you can look at that for the state, but you can also go down here and you can click on Lyon County, and it will tell you information about Lyon County that you can look at, the population, and that whole breakdown of how many people have been vaccinated. The other thing that it does, if you go over here, and I didn't show this because on my screen I can't see it because my face is there. This gives you the whole state, the population of 12 to 15-year-olds and all the age breakdown, how many people have been vaccinated. And you can go out down here and see that that's 42% of the 12 and 15-year-olds in Kentucky have been vaccinated. But if you want to know about Harlan County and you click on Harlan County, it tells you that 369 12 to 15-year-olds have been vaccinated. That's 28% of the population of that county. So it's a real interesting piece of information that I think is helpful for people. And there's other information on this page, but these are some things that I wanted to be sure that you were aware of, because I think you can share that with folks that you interact with. Down here, when it talks about booster shots, it gives you that breakdown of who can get a booster shot. So I kind of, when people say, oh, this is so complicated, and I try to say, you know what, if you tell people that something's complicated, it's complicated right that very second before you even open your mouth. It's not that complicated. If you're old, and I say that because I'm over 65, if you're over 65, you get a booster. If you're over 18 and you live in a long-term care setting, you get a booster. If you are sick with some medical issues, and the list of medical issues is very long, you can get a booster. Hypertension, diabetes, obesity, smoking, you can get a booster. And if you live or work somewhere that's high risk, and that would be the grocery store or the intensive care unit, anywhere where you're up close and face to face with people, you can get a booster. And if you receive J&J, you're right, Emily. Anybody that got J&J can get a booster right now. And then this just tells you how long after your last dose you can get a booster. This additional dose is kind of confused some people. So sometimes if you have an example, it helps. I have rheumatoid arthritis. I got my 2 vaccines. I was cruising, feeling really good this summer until I read a study that shows because of the medication I take for my rheumatoid arthritis, I probably only had about 42% protection from COVID, which did not make me feel really good, at least in this one study that I looked at. So I got an additional dose in August. It was a full Moderna dose, 3rd dose. So I won't get my booster now for 6 months after that. So there's additional doses for people. And if you click on these links, it takes you to the CDC website that shows you people that have had cancer, people that have had an organ transplant, and people that take medications that suppress their immune system to get the additional dose. So this pretty much covers the basic things you want to know. We've got, so all of that information is on the website. If you are a real data geek and want some more information, you can go to DPH data. And if you look at some of this information here, it will tell you the map, the big map that you see on the first page. It gives it to you broken down by county if you're interested in your county. This vaccine data is the same stuff we just looked at, but this one is the piece that you might find interesting. These are the slides the governor uses on his press conference. We update these every Friday. So there's the COVID chart. He calls it the stair stepper chart, the purple chart. Here is the positivity rate by week. Here is hospitalizations. Here's the ICU, and here's the ventilator use. The graph, the table he shows you about who has been vaccinated, not vaccinated in our cases, hospitalizations, and death, showing you that you're 3.7 times more protected from dying if you've been vaccinated. And this just shows you that since we've been looking at, since July to October, there have only been 9 deaths of vaccinated people under the age of 50. Everyone else who died was unvaccinated. You can download these slides. If you want to use these in a PowerPoint presentation as you're trying to talk to people, you can do that. I would have been asked about monoclonal antibodies. There is actually a link to that. And if you click on the view availability, there is a map. And you can click on that map, on the little pin on the map there, and it will give you information. So let's pick on this one since it's out there. Of course, it's too small, at least for me. So Lewis County, and you can look up how to get in touch with Primary Plus Vanceburg to be sure that you can get your monoclonal antibody. So I think you can find a lot of really good information. The children 5 through 11, they're meeting right now voting on that, but we have been pre-ordering childhood vaccination, our supplies. So we got those pre-ordered. We should be getting them next week. We're waiting right now because, at least for the health departments, since we don't have a physician or an APRN in every health department, there's standing orders that we issue here from the state. So we're waiting on that information. We'll get those out to the health departments early next week, and they can start vaccinating. Other entities will hear the same information we'll hear today. So we'll be able to start vaccinating next week in Kentucky, as long as ACIP and the executive director of CDC issues us some guidance. So that will start next week. That's all the things I can say of in one breath. Emily, what else did I need to cover?
I think you covered it. Thank you so much. That dashboard is really fantastic. All those resources that you shared. And they're easy.
Like I said, I could not do this if it was not easy. So, and if you have other questions, please, Connie.white@ky.gov. It's a real easy a real easy email. Happy to either put it in the chat or send it to me some other time. I'm happy to answer questions or get you to the person who can.
Thank you very much. And for those of us with little kids, it is just so exciting to finally have a vaccine that's been approved, another one that may be approved soon, and know that we can start protecting our kids from COVID. So after many, many months. I think now I'm going to turn it over to Kara and Priscilla to talk about open enrollment and our long-awaited relaunch of Connect.
Thanks, Emily. Hi, I'm Priscilla Easterling. I'm the Outreach Coordinator with Kentucky Voices for Health, and I'm really excited to talk about open enrollment. It's a huge month for health updates. Since last month, Connect has relaunched, which we have been talking about for the last year. It is now open enrollment for Marketplace, which ends January 15th, for Medicaid, which ends December 1st, and Medicare, which we won't talk about, but also ends December 7th and is going on right now. And I'm really excited to turn this over to Deputy Secretary Carrie Banahan to give us some updates about open enrollment.
Very excited to say open enrollment began November 1st. Just to give you a few updates. So we had 581 individuals submit a new application. We had 4,736 document uploads. We had 1,592 people create a new account. and we had 954 individuals actually browse and review Connect plans that were offered. So we're very excited about this. And do you have the slides? I'm also technically challenged, Dr. White, like you. So I sent them my slides so they could upload for me. So, because all right. So for 2021, we had 2 insurers offering coverage in Kentucky. We had Anthem that offered in 120 counties, and we had CareSource, which offered in 94 counties. And you can see that, you know, for the most part, Kentuckians had 2 choices, but then in some of those far western counties, Kentuckians only had 1 choice. Now, if we can show the map for 2022. So this year, we're excited to say we have 2 new insurers to the marketplace, WellCare and Molina. So CareSource this year is offering in 6 additional counties. WellCare is offering in 63 counties, and Molina is offering in 3 counties in the Louisville area. So, you know, that area, they have 4 choices: Oldham, Jefferson, and Bullitt. Folks in Eastern Kentucky, parts of Northeast Kentucky, a few counties in Western Kentucky, they have 3 choices. Others have 2 choices, and we've reduced the number of folks that have 1 choice. So we're very excited about this. Last year, we had 71 plans that were offered on the exchange. I'm sorry, last year we had 36 medical plans that were offered on the exchange. And this year, we almost doubled that number, and we have 71 plans that are offered on the exchange this year. So, you know, there's just more choice, more opportunity for individuals to buy coverage.
That's really exciting. More companies having more options, more availability, more choices. That's always great for consumers. Can you tell us a little bit more about the Cabinet's promotional activities, just helping to push open enrollment and really encouraging Kentuckians to go out and participate in open enrollment, check out the plans?
Sure. So yesterday, some of our connectors had open enrollment events. The governor announced that the launch of open enrollment at his press conference. There was also a press release working with our connectors as well as our agents. There are going to be more opportunities, community events for individuals to apply for coverage. If you go out to the Kentucky Health Benefit Exchange website, they'll have there's a list of monthly events where individuals can enroll in coverage. So you might want to check that out through social media, through Twitter and Facebook. We're notifying individuals about open enrollment and different events as well.
Awesome, that's great. And connectors will be having events all throughout open enrollment and meeting people where they are.
Exactly right. So open enrollment lasts from November 1st through January 15th. If you enroll in a plan prior or on December 15th, your effective date of coverage is January 1st. If you enroll between December 16th through January 15th, then your effective date of coverage is February 1st. So, you know, we're encouraging everybody that wants coverage to review and check out all of their options, you know, by December 15th if they want coverage effective January 1.
Perfect. That's great. One of the things that we've been hearing a lot about was a little bit of confusion around the phone numbers. Could you help just clarify what numbers everyone should be pushing for health coverage, where we should be telling our consumers to go?
Right. So individuals that want to apply for health coverage or have questions or might want to know more information, they should be calling our contact center at 1-855-4CONNECT. Now, if you want to know about other benefits and resources that are offered by the cabinet, then that would be our other number. It's Jason, you might have to help me. 1-855-806, is it 9353? Jason Dunn?
I'm sorry, I hit the wrong button.
306
8959.
Oh, I said 8953. Okay, all right. So say that again. It's 855-806.
306 8959.
So if you're interested in applying for SNAP or childcare or TANF and Medicaid, and you can also apply for QHPs through that number, but we are specifically directing people to that 8554 Connect number if you're only interested in healthcare coverage, whether that's Medicaid coverage or qualified health plan coverage. And good news, I think the landing page, the connect.ky.gov landing page, we're going to be making a change fairly soon where we'll say Connect Benefits, it's the 855-806 number, and then Connect Health Coverage, then we'll have the 8554 Connect number, just to prevent the confusion. I know it's confusing out there with the two numbers, but hopefully with the change on the landing page, that will help individuals go to the correct number.
That's really exciting news. We have heard that a little bit of confusion a lot, so I'm so glad to hear that. So just to double down, for health coverage only, call that the 855-4 Connect number.
Connect, right.
And then for all other benefits, call the DCBS line. That's
yes.
Perfect. Thank you so much. Speaking of that DCBS line, one of the things that we heard in a couple of meetings previously was that they were going to be doing some hiring to help with the long wait times. Do you have any update on that process?
So Lisa Dennis, are you on the line?
I don't think I saw her, Carrie.
Okay.
Sorry.
Can you address that, Jason? I know it's my understanding that you all have implemented some different administrative procedures that have helped somewhat with the wait times. I don't know if you can address that, or when Lisa Dennis gets on, maybe she could discuss that.
I think Lisa will probably be able to give you a fuller description. I know about as much as what you just said, Carrie.
Okay, all right. So, but I do know that DCBS is trying to hire additional staff. They are, they have high turnover, and they are in the process of hiring more staff. But Lisa will be able to address that when she gets on. So.
Perfect. Thank you. We definitely understand, the turnover. So just wanted to check in on that because that is a regular concern that we hear around the wait time, but good to know that there is possibly something in the works. One of the other questions that we had, there is a new issue tracker for connectors and agents. And I was wondering if you could tell us a little bit more about if you know of any of the issues that have been reported, and how Deloitte/Connect address them when they receive them.
So, with the implementation of any new system, there's going to be a little bumps along the road, as well as some bugs, issues to address. So last weekend, we sent out our open enrollment notices to individuals that were passively renewed. We passively renewed about 80,000 individuals, and all of those notices were supposed to be sent out last Saturday, but our Commonwealth Office of Technology printing office, one of the printers broke down. So we honestly didn't get all of those notices out to last Friday. But if you had elected email, though, we did email you your notice. We did have some issues with our pre-screening tools, where when you pre-screened for a qualified health plan and you were eligible for an advanced premium tax credit, the calculation wasn't exactly correct. So that was fixed last week. So, the issues are reported to us, sometimes by DCBS, sometimes with the Kentucky Health Benefit Exchange staff, sometimes with agents and connectors, and those are logged. We look to see whether it's a defect, is it a quick fix? We look at the level of effort, but as a whole right now, things are going well, So any questions about that?
That's all wonderful updates. I love to hear that all of these sort of bugs are being ironed out. We know that October 15th was the soft launch. So right. Between then and now and November 1st, there were a lot of changes that were made to sort of help smooth some of that stuff out. So That is excellent news. And then I guess I had one last question. During Governor Beshear's press conference, he had talked about the state saving about 15 million just from switching from the FFM to the SPM. Can you talk about how that savings is passed on to consumers?
So last year, individuals' premiums were increased by a user fee that was charged on healthcare.gov to cover system cost and call center cost. And that ranged between 2.5% and 3%. So we're not charging that, with our state-based exchange. So consumers in Kentucky, for plan year 2022, because of that, saw a reduction in their premium amount.
Awesome. And so this year, by being on SBM, they should save around 2.5% to 3%. Is that right?
That is correct. Yes.
That's exciting. That plus those additional savings from the American Rescue Plan, it definitely sounds like the marketplace has a ton of affordable options that should be available for a lot of consumers throughout the state.
Mm-hmm. That is correct.
Perfect. Do you have anything else about open enrollment that you want to make sure that any message that you want to make sure that everyone hears?
I just want everybody that if you are enrolled in a qualified health plan currently, I encourage you to go out there, shop around and review your options. You might find a plan that meets your needs better than the plan you're enrolled now, and you could receive a lower premium amount. Are there any questions from anyone?
Carrie, I also have a question. I'm so excited about how many more plans are available to Kentuckians and how many more choices that people are going to have this year. That makes a big difference in people's lives, moving to 71 plans from 36. But how is that affecting the passive renewals? Like, how are the plans matching up from last year?
So when we passively renewed the individuals, we enrolled them in their existing plan, their Anthem plan or their CareSource plan. So we have sent out notices that will advise individuals, even though you're enrolled in a plan, we encourage you to shop around. We have more options, more plans available that might meet your needs better. So, we're telling everybody, browse, review, see what your options are.
Deputy Secretary, this is Kara. I want to follow up with one more about what are the status of Kentucky's, the federal options that are currently under consideration to cover more people. Could you comment on the status of extending postpartum coverage to 12 months or any other?
So I will defer to Commissioner Lee on the postpartum coverage. So, and that's for Medicaid. That's for Medicaid.
Yes. So states can submit a state plan amendment in April of 2022 to cover postpartum women after they give birth. In the Medicaid program, we can cover them up to 12 months, and that is something that we are currently exploring. But again, it would be in April of 2022. But I do think I've been monitoring the chat, Carrie, and I think there's a real important question here about can a person get marketplace coverage if they have insurance through their employer? Can you get both?
You cannot. I mean, you can't get an advanced premium tax credit to reduce your premium costs. You can enroll in a qualified health plan, but you have to pay full price. If employer coverage is available to you, you're not eligible for the tax credit on the exchange.
And so too, I think this is a good opportunity to bring up the Kentucky Health Insurance Premium Payment Plan in Medicaid. So if you do have insurance through your employer and you qualify for Medicaid, Medicaid will pay your premium. So you would get those additional wraparound services that Medicaid covers that your insurance does not. And I would definitely encourage you to check into that if you think that you may qualify for the health insurance premium payment plan that we have here in Medicaid. That's a really good program.
Mm-hmm. Any other questions, Kara?
I think that's it for us. I think that we're going to move on to talk about PEBT and SNAP and the status of emergency allotment. So I think that Jessica Klein from KY Policy is ready to set that up for us. Thank you all.
Thank you. Hi, yes, I'm Jessica Klein. I'm a policy associate with the Kentucky Center for Economic Policy. I'm going to provide a little bit of a background on the two food assistance programs we're going to talk about today. The first is going to be the Supplemental Nutrition Assistance Program, or SNAP, which provides food assistance to about 522,000 Kentuckians as of September. And that's about a decrease of 100,000 participants since June. Throughout the pandemic, that program has seen several waivers and changes to get more food assistance to families that need it during the pandemic. And that includes emergency or max allotments, which we'll touch on today. More recently, the program beginning in October has seen a federal increase through the Thrifty Food Plan, which has permanently increased SNAP benefits for Kentuckians just in time for the ending of another policy, which provided a 15% increase throughout the pandemic. The second program that we're going to talk about is the Pandemic EBT program, or PEBT. It's provided over 600,000 Kentucky kids with grocery money to make up for school meals that they've missed throughout the pandemic. Early research shows that PEBT has provided help with food hardship to kids of about 30% the week following disbursement. So a lot of good evidence there to show that that program works. Our last disbursement was in August and September for summer EBT and the child care PEBT program. So that was for last school year. So this time we're going to talk a little bit more about this school year. So with that, I'll turn it over to the Director of the Division of Family Support, Jason Dunn.
Yes, Jessica, we have to quit meeting like this. This is our second meeting we've been on today with Jessica and Tyler and company. So I'll do an update on PEBT. I think there's a lot of questions about what's going to happen with PEBT for the 21-22 school year. As you know, each of these school years during the pandemic has been wildly different from one another. So, when the pandemic first began in March of 2020, practically, I think every school was off and all parents were eligible, all students were eligible for the PEBT reimbursement for not being able to receive those meals that they would have received in school. So the last school year, the 2021 school year, was a little bit different. We had some months where schools had gone back, and then when the pandemic started to increase again, we had a lot of schools that were off, and almost every school again was off for a certain period of time. Some were completely virtual instruction, some were hybrid. So we were able to tailor the benefit based on the predominant method of instruction in that school, depending on what that school like, with some exceptions for folks who fell outside of those categories. And then, of course, we did the summer PEBT that Jessica just mentioned that was issued in August that covered the months of June, July, and August. So 21-22 school year looks incredibly different than last year. Of course, we had that bump at the beginning that kind of coincided with the beginning of the school year. So as schools started going back, they started seeing the need for taking some time off. There were some individuals who had to quarantine. There were classes that had to quarantine. And then some schools ultimately, took a week or two off to try and have a break to break that contact between students. And whether there was instruction provided or not, every school was a little bit different. Every school system was different. So that makes it extremely challenging to write a plan that will capture all of those different situations. What we're looking at, it's a struggle not just for Kentucky, it's a struggle for a lot of states. We don't have a state that has an approved PEBT plan for this year so far. I think the closest state was Indiana, but they still had a ways to go too. Schools also have different systems in place for collecting attendance data and therefore school meal provision. Kentucky does not have a statewide system in place to do that. A lot of states don't have that. That makes it hard to figure out what to do. So we are writing our plan for this year. We think we'll have a draft ready to start discussions with FNS at the end of this week or the beginning of next week. It keeps changing because our guidance keeps changing. And then, of course, once we do have what we think is a good plan, we have to receive approval from our federal partners for that. And then we'll have to make system changes to accomplish that. We likely will be looking at an online application of sorts, like we did for the first round of PEBT, just because it's not going to be easy. We might have pockets and situations in certain schools where we can say, okay, every student in this week is eligible for PEBT, but that's not going to cover all of the different situations that people are facing. So we have to write a plan that accounts for all of those different situations and system changes that account for all that, and then be able to communicate that directly to folks through organizations like yours, so people know what to expect, whether they're going to get a payment automatically or if they're going to have to go online to provide some data for us to go research. We'll like, again, be working closely with the school systems to do this as quickly as we can. It's going to be much more labor intensive for us. Our federal funding agency, the Food and Nutrition Service, expects that we will issue far less in PEBT this year, that they expect a plan that will reflect that. And unfortunately, that's reflective of the attendance that kids have in schools right now. We do have two pieces of clarification that we can provide, that I can say for sure right now. There's a good news, bad news. The bad news is that if schools set up a virtual academy at the beginning of the year and parents elected to send their children to a virtual academy, they will not be eligible for PEBT reimbursement because that was a choice the parent made. The good news is that, when we were talking about those, schools that took off a week or two in order to kind of break that contact, whether they went to virtual instruction or if they just considered it a break with no instruction, they're going to be PEBT eligible as long as it was a break that was caused by COVID-19 and the desire to do something about it, break that contact between kids and help with the spread. So once we get that approval, I'm doing a reality check for everybody, including myself. Once we get that approval, we have to do our system builds. We have to validate data, all those wonky things that we have to do to make sure there's good security and good accountability for the benefits that we send out. I don't anticipate us being able to issue benefits until the spring for this school year, just to be real. I was on a call with state SNAP directors last week, and we were all discussing these issues. It's kind of cold comfort to know that all the other states are kind of in the same boat, but there's still states that haven't issued the summer benefit from last summer. So that's those are the rules that we're being provided, and we have to work within those rules with our federal partners. Again, we were really hoping for some ways to simplify the assumptions and make those benefits easily available. It just doesn't look like it's going to happen this year. So we'll keep everybody updated. We'll certainly keep folks in Thrive Kentucky updated as we go along and as we make progress towards that plan approval. The emergency allotments I'm trying to tell myself it's not the maximum allotment, because emergency allotment provides some households with more than the maximum allotment, which is great. It's great that we had the increase in benefits in October to more than make up for the loss of that 15% extra we were getting, like Jessica mentioned before. But again, just as for background, in order to be able to issue these emergency allotments, we have to have both a national and state declared states of emergency for COVID. Some things just require the national. This requires a national and state. Our state state of emergency is right now good through January the 15th. And I know our legislature will look at that when they come back for their legislative session in January. So we'll see if we can continue to provide it since after that. We do have to ask for it every month from our federal partners. Even though we know we're scheduled through January, we have to provide an estimate of what those emergency allotments are going to cost each month. I'm not sure why, because we're going to issue it anyway. But anyway, there's a lot of accounting behind SNAP. So if we do lose our state of emergency, our state declared state of emergency on January 15th, we will have one additional month of emergency allotments to provide. So we know we're good through February of 2022 at this point, barring any changes in the state declared state of emergency, or the federally declared state of emergency for that matter too. So I want everybody to have that on their radar. Right now, emergency allotments account for about 42% of our issuance. So, so as soon as that goes away, we're going to issue 42% fewer benefits than we were during the times we were issuing the emergency allotments. So the average household will see a 42% reduction in their benefits once this ends. So that's unfortunate. You know, we know that food prices are increasing, and you know, I don't know that that's going to happen before we lose this additional benefit that we can provide. So so that's my update on that. I know I'm all doom and gloom today, so I'm sorry for that, but that's the reality of it right now.
Thank you for clarifying. There is a little bit of confusion in the chat, so I just want to clarify one point you said about PEBT, which was there's kind of a difference between being quarantine or virtual one day versus a full virtual academy. I don't know if you can kind of restate what you said earlier about virtual academy, kind of clarify the difference. Those two. Mm-hmm.
Yeah, I think it was an option in some schools. I don't think there were a lot of schools that offered this option, but there were some that offered a virtual academy. I know we did here in Franklin County. I don't think the uptake on it was a whole lot of students, but that was what our federal partners had made, you know, given us guidance on that said, you know, if it was a virtual academy, that you know, that's how the school year started for those people who selected to go to that. Now, if your school had to delay start because of COVID or some other thing, or if your student had to delay start because of COVID, and it was either virtual instruction or not, that's different. You'll likely be able to get PEBT for those days. But I'm just talking about folks who sign their kids up for an actual virtual academy. I know it's splitting hairs. That's what we get from our federal partners. We get hairs to split. So, but you know, in any event, I think, you know, if there's a question about it, once we have the ability to put student information in the system and work with the school systems, we'll look to see if kids are eligible. So I don't want anybody to make an assumption that they can't get it if they maybe can. So I would always err on the side of applying versus not applying. And I'm calling it an application. It's not really, it's just data collection, putting your student ID and your student name in there so we can go back and look at check with the schools to see if you're eligible for days.
Right. Okay. Thank you for that clarification. Yeah, I think people were a little confused about like virtual as in I took my kid home for one day and they were virtual, or the school declared it virtual for a week, versus a full virtual academy where it was several weeks at a time for the whole school. Those are two different things. Thank you.
Right.
Thank you.
Yeah. If you want perfect clarity, I don't know that I can give you perfect clarity today. So this is something that we're working through right now. So we'll know a whole lot more once we have an approved plan and we have all those parameters set by FNS. And again, I'll absolutely bring it to this group to provide updates.
Thank you, Jason. I know we touched on emergency allotments. There were a few other questions around SNAP, if you don't mind us kind of switching topics back to that. One was recertifications. We know that they were in pause during the pandemic, slow to start back up. Is there an update on how those are going?
Yeah, we had, there was, whenever you stop doing something for a while, it causes this backup. It's like damming a river. And then once you burst that dam open, there was a flood. There were a whole lot of recertifications that we had to do. And in some months since April, it's been, and in some cases, twice as many as we normally do in a month. So the workload has been incredibly high. And of course, I would like to make sure that folks who are still eligible for SNAP remain eligible for SNAP. And we want to complete as many of those recertifications as we can, because that prevents work down the road and it prevents interruptions in benefits. And so I think we're through the biggest waves of that. I think our workloads are back down to what would be normal. Of course, we're down several staff at this point too. And we mentioned we're, trying to fill those positions. But some of the things we're doing to help families understand we need to renew, that we're doing what we call nudges. And it's just like when you have an appointment with a doctor or a dentist or whatever, you're due for a renewal. We're doing some automated phone calls to those households to let them know, hey, you're due for a renewal. Here's how you can do it. And you can call us at this number. You can go on to Connect. You can come into the local office, however you do it. We're also doing the same thing with what we call mid-certification reviews. Those are required reviews at the 6-month point for most families that have a 12-month certification period. It is a requirement that this form is sent in, whether you have changes or not. You can mark on there that you don't have any changes, but we have to have that report into us. We've automated that on our phone system through an interactive voice response. We can capture those declarations that you don't have any changes and telephonically sign. That's a huge help, because that's about 80% of those reports are that folks don't have any changes. We're also sending in, calling in reminders if folks have documents that they still need to turn into us. So, if you have a request for information to return proof of your income, you could get a phone call that says, reminder, you have this day to get in your proof of your income. So all those nudges have helped tremendously. We've gone from a recertification completion rate of about 42%. Now, this was measured at the end of the month. So that doesn't mean only 42% renewed. Some are probably late and renewed after the first of the month and into the next month. But we went from 42% up to 67% in a couple of months' time. So I think those nudges are really helping. Those reminders are helping. And that just ensures, of course, that benefits continue. It doesn't sound like a high rate, but of the states that I've talked to, I think probably in the high 60% to 70% is about as good as we can hope for on completion of renewals. That's part of the churn. We're going to keep looking at ways, to make that process easier. We want to know what the pain points are for families out there getting documents to us. We still have to stay within federal rules, but we also want to look at any way we can do to help make that easier too. So.
Thanks, Jason. And I'll just touch on one of the questions we hear a lot around recertifications is, does the new CTC or other public benefits or relief programs count against my SAP application? And how do I figure that out?
The child tax credit does not count for any benefit that we administer, not SNAP or anything else.
Thank you. And then you mentioned a lot of the new capabilities that you can do over the phone. If somebody is interested in in-person help, do they need an appointment to talk to their DCBS office? And how would they go about calling or finding their DCBS office?
If you have I'm going to put a link into the chat for the local office locator. People can put look in their county and see where their local office is. But we are making appointments available to folks. We have a not great system right now. It's kind of a cobbled together site right now, ability to do that right now. But we are incorporating appointments into the Connect system. We're working on that now, so it'll be coming in the next 3 or 4 months, probably, maybe less than that, I hope. But if someone needs to apply, don't make an appointment. That's what I always want to stress. Your benefits begin the day that you apply. They're prorated from the day you apply for SNAP. So don't delay and try to make an appointment. I want to, stress that people just need to call our 855-306-8959 number to apply, or come into their local office, or go on to that connect.ky.gov. Create an account, make your application on there, and start the application that way.
Great. Thank you so much, Jason. I think that's everything we have for today, but I'm sure that we're looking forward to more information as it comes out around all of those changes you've mentioned. So thank you so much.
Absolutely. And now I'll go dive into the chat, because I know it's been going and I've tried not to look at it because I'll get distracted. So
thank you.
All right. Thanks, everybody.
Okay, I think I'm up next. Is that right, Emily? All right. So I'll try and move quickly because I know we're running behind here. I know there's been a lot of attention paid lately to the negotiations around the Build Back Better plan, and that's right and good. I think there's a lot of really exciting opportunities in that. But in the meanwhile, there's been a lot of implementation work on the federal dollars that have flowed through the state. And so today we wanted to get a few updates on the money that has come through our Department of Child Care. So we have Sarah Vanover here today, who's the Director of the Division of Child Care, to talk about that. We wanted to hear a little bit more about our home and community-based service funding. There was a 10 percentage point increase in the federal spending through that program. And then I also wanted to hear a little bit today on how we are spending federal dollars that are designed to increase our public health workforce. So we'll go ahead and get started with childcare. I mentioned Sarah Vanover's with us today, and childcare was really, I would say, almost transformationally funded through ARPA with $764 million in 2 pots, one through what you could call stabilization funds, and another through expanded grant that we normally get to help pay for childcare. So I asked Sarah to come on and talk a little bit about just what are some recent updates, not to talk about the whole plan. If folks want to know about that, we can direct you to some good resources, but really kind of what has been done more recently with those funds. So Sarah, why don't you go ahead?
All right, so like you said, we received just over $763 million for childcare, which is amazing. We're so thankful. The biggest portion of that, 470 million, is going towards stabilization payments for childcare programs. Kentucky is going to give them out in 9 payments over the next 2 years to kind of encourage providers to remain open during that stretch of time. And we also are doing it on a tiered system where the more you pay your staff, the more you're going to get. And that's extremely important right now, as I'm sure you can imagine, because staffing across the nation in every industry is very challenging right now. Finding enough staff to operate is huge. And with childcare, when there are no childcare staff, then nobody else goes to work either, because somebody has to provide a healthy and safe environment for the kiddos, or parents won't leave them. So in Kentucky, we still have a lot of centers that are paying close to minimum wage. And so we are trying to push those centers to baseline pays of $10 and above, or $13 and above for all staff, including kitchen staff, janitorial staff, anybody who works and makes the lives better of our kiddos in those facilities. We're pushing that up. Those contracts went out about a week and a half ago, and they were due back today for the first payment. Now, if providers don't want to get paid this first time, if they're thinking about it and they're like, I don't know if I want this federal money or maybe not, then it is a rolling application that they could enter at any point in time during the next 2 years. But they, the longer they wait, the more payments they would miss. And they can move tiers during that time period. If they started off on the base tier where they can pay their staff minimum wage or whatever, they can come back in 6 months and say, okay, I've figured out how I'm going to pay my staff more. And so I want to apply for that higher tier, and they can do that at any time. So that is in mid swing. We have a third-party company that's going to help us get all those payments out, because my staff are maxed out right now. So we finished the RFP process for that, and we've got a company that's going to assist. And so we're really excited that that's going to move into full gear, and we're hoping that the first payment goes out at the end of this month, or worst case scenario, the very beginning of December. Now, the other money was $293 million put aside through Child Care and Development Block Grant, one-time funding. We get annual funds for that, as Dustin alluded to, but this project really focused on, this money was focusing on serving underserved populations, improving policy on child care payments, as well as making sure that providers are getting higher wages. So some of the big projects, the largest project financially out of that money is to increase the child care assistance program. Kentucky previously paid reimbursement at the 40th percentile for child care subsidy, which means that the full amount of payment covered the cost of 40% of centers in the state. We've increased that now to reimbursement at the 80th percentile. So that means that a subsidy family could have full access to 80% of the child care programs in the state without having to pay an overage fee. We're also going to be doing some other subsidy things at the beginning of the year, including increasing the entrance level, federal poverty level at entrance from 160% of the federal poverty level to 200%. And that will help with some of the families who are just barely over that breaking point, but still childcare is such a huge burden. And we all feel that. I mean, I had an infant and toddler and childcare at the same time, and it was $400 a month more for childcare than it was my mortgage when I was paying for my kiddos when they were that little. And so families in a low income bracket, it can really be a struggle for them. We're also going to be adjusting the cliff effect nature by doing a phase out program for families that no longer qualify. They'll still get 50% of their subsidy amount for 3 months as they kind of gradually move into paying for themselves. We're doing a lot of workforce initiatives, free degrees, free trainings, things to help our child care providers show the community how valuable they are and that they deserve those higher wages. And then we're also doing a lot of startup fundings, matching grants in communities that are childcare deserts, or matching grants for businesses to add employee-based childcare. We'll put up money and they'll put up money to help expand in those areas. So we're working on a lot of that right now. We have one program that is underway already, and that's our preschool partnership grants. Many of you know that public school preschool, state-funded preschool, has the best special ed resources throughout the state. Children can enroll if they qualify due to a disability or due to income level, and they can get a lot of special education support. But those programs are typically just 3 hours a day, sometimes only 4 days a week instead of 5. So we are working on a public-private partnership where the public school preschool would partner with childcare programs in their area. And after the children have completed their 3 hours of care through state-funded preschool, then they would go to a high-quality childcare program to complete the rest of the day, so that those kiddos still get the services they need from the public school, but working parents have a way to make sure that their childcare is provided through the entire day. So we're really excited about that. That will be beginning in January. We had 43 school districts apply and start that process, and we will open the application again for school districts again in February for programs to start in August for the full school year. So that's kind of where we are right now, but we're working a lot towards supporting parents, increasing provider wages, and additional training, workforce training for our childcare providers.
That's an incredible amount of work, very quickly and excellently done. Just a quick question about increasing the initial income eligibility rate for CCAP from 160 to 200%. When is that going to go into effect? Because I think, so a lot of the folks in January, okay. A lot of the folks in this call have been pushing for that for years, and it's really exciting to hear, especially as it pertains to the partnership program. So that's really important.
Now, of course, this is temporary. It's funded through the American Rescue Plan. Now, if Build Back Better provides additional funds to childcare, which we are considered essential in that infrastructure, then there's possibility for it to last longer. But that will begin in January. It couldn't begin at the same time as the subsidy reimbursement because there were a lot of computer systems that had to be updated in order to get that all in place for when families go in to prove eligibility. But what we're looking at is late January at this point.
Excellent. Thank you. Well, I'm going to keep moving quickly because we have a couple more folks to go through. Commissioner Lee, do you want to talk a little bit about the increased funding for home and community-based service waivers? I know we submitted an application and it was partially approved. So it sounds like there are some things we can move forward with and some things we're still in conversation with CMS over.
Sure. I'll start with the timeline first. In July of 2021, we did submit our initial spending plan. We received partial approval in September 21. In October, just last month, we resubmitted the plan with additional information and are waiting on some information from CMS. We did also accept the Advancing States American Rescue Plan Act Technical Assistance Project. So we have been accepted into that so we can get technical assistance. And we're also working on a vendor to help us, or a contract that we have with our sister agency in Dale, the Department for Aging and Independent Living, working on getting someone there to help us as we move through the process of expending these funds, because as you know, it's quite a bit of money, and we want to make sure that we can document everything appropriately for CMS. We do have, I think in your agenda, it states about 96.8 million. Our request is an estimated $490 million. So some of the things that we are beginning to work on are more administrative tasks right now. For example, workforce development and growth, developing a training plan as we move forward that we can include in future. We think that it'll create sustainability for some of the projects that we're working on. We'll create a foundation for making our efforts successful if we have some of these administrative pieces in place. Our initiatives, definitely, or workforce development and growth, we were focusing 35% of our funding on that. Waiver access was 30% funding. Crisis services was 20% funding. And then tools and transformation, 10% funding, and with some project management, about 5%. So a few of the things that we have received approval on are going to require a little bit more work to put in place. This is not, a pot of money that we just have that we can distribute. We have to perform the task first, and it's exactly like drawing down federal dollars for the Medicaid program, in which we expend our funds and then we draw those funds down. So we have until March 31st of 2024 to draw those funds down. And as we continue to work through our plan with our sister agencies, we'll definitely engage our community partners to make sure they know what we're doing as we go forward to draw down those funds. Be more than happy to answer any questions about those FMAP funds. So basically we have to perform the task before we get the funding, and we are still formulating some plans for some of those expenditures that we have been approved to implement.
Very good. I will wait to see if there's any questions in the chat, but in the meantime, for the sake of time, we'll move on to, I guess, Dr. White, on some of the extra money that ARPA had for state departments of public health, specifically around workforce challenges. And I know that those dollars, like all the rest of the ARPA dollars, are temporary, that we talked about, but hopefully, especially during COVID, that they can help with augmenting some of our staffing needs. So do you have any update on how much money that represents and what we're planning on doing with it?
Well, the person that actually wrote that grant, I contacted her, and she's out picking her daughter up right now. So I don't have the horse's mouth to be able to tell you everything that was planned, but this was really a labor of love in the department to pull everybody together and say, what is that thing that you've always wanted to do that we've never been able to do? So we are looking at things from helping to get educational opportunities for staff, people that are interested in working on graduate degrees in public health. We're looking at a little bit of the money on working with universities. One of my pet goals since I've been here is I can look out my window right now and see Kentucky State University. We need, if we're going to diversify our workforce, we need strong ties to historically black colleges and universities. I've talked to some other deputy commissioners in other states and have helped, have forged some really great relationships. So that's in the making. I mean, I can't give you all of the examples, but I think it's going to help us with our attempts to do more diversity, to have more students, graduate students, undergraduate students coming in, so we can expose people, whether they're going into public health or not. We need everybody in social work to understand public health. We needed everybody in medicine to understand public health, dentistry. So the more that we can get people to understand the thought process of how we reach out to people, what social determinants of health are, those kinds of issues, then their thinking will be able to present their work to the patient in front of them in a much more meaningful and effective way. So I would like to have Rebecca Gillis come back at your next quarterly meeting, Emily, if that's okay, because she can give you a much better a better look at what was involved in that grant application. We are getting lots of good feedback from the CDC that they don't think this is going to be a one-off. They really think that I feel like I spend all day putting lipstick on the pandemic pig, but if we got any lipstick on this pig, one is we need the workforce. We cannot expect the next pandemic, and there will be one. And also, it has unearthed things that we should already be doing on a regular basis that there just has not been bandwidth for. So I think that we've gotten some good vibrations from the legislature in Washington that they are committed to continuing to fund this more than just a year or 3 years, that we are expecting to see funding, as we have seen funding for the substance use disorder for several years now, which has been critical, because you're right, that one-off funding doesn't get you, that just kind of almost frustrates you. You actually see what you can do, you start doing it, and then you can't do it anymore. So if we can have Becky come next time, I think she can give you a better overview, because she really did pull everybody into that conversation.
Yeah, that would be great. I think that would be really interesting to hear and helpful for folks. And I'll just say, I think this money comes at a good time, and hopefully the Fed's Congress will come through with more sustained funding, because our public health workforce has declined about 37% between 2012 and 2020. And during that time, we had an opioid epidemic, we had a potential Hep C outbreak, we had a Hep A outbreak, and then we had COVID. And so there's a lot of need, and I think the value of the public health workforce has really shown true over the last 2 years in ways that I hope will really spur a lot of public investment. So thanks, I appreciate the update.
We had a harm reduction summit in August. This is our 5th one. We had over 900 people virtually from 27 different states to attend that. It was very broad reaching, but we called it the epidemic of epidemics because it's a substance use disorder epidemic, it's a hepatitis C epidemic, it's a neonatal abstinence syndrome epidemic, it's a foster care epidemic. You go on and on and on, and it pulls every aspect of the cabinet as we battle with this. Substance use disorder is the #1 killer of women that are pregnant or are in the first year after pregnancy. So we're working on those aspects as well. So it's very broad reaching, and we're trying to put out all those fires at the same time.
All right, are we moving on, Dustin? Okay, well, speaking of the public health workforce, I think that this is a very good segue because many of you know that I am a big fan of community health workers. And of course, we know that CHWs are a very important part of the public health workforce and really act as a liaison between public health, the healthcare workforce or healthcare sector, and social services. And part of the reason that they're so successful, or maybe the primary reason, is because they are trusted resources in their community. They are part of their community. And we know that they are every day helping people meet their basic needs, things like food, transportation, housing, and of course, getting access to healthcare. And so we know that there's been a lot of work happening at the cabinet to look at how we can expand our community health worker workforce and also make it more sustainable through different funding streams. So I wanted to take the opportunity today to learn a little bit more about some recent grants that y'all have gotten, some plans that the cabinet has for looking at sustainable funding. We know that through the Affordable Care Act, of course, that was passed, gosh, it's hard to believe, 11 years ago, but in 2014, the ACA made it an option for states to make CHWs Medicaid reimbursable. And of course, that's sometimes easier said than done, but there's been a lot of work laying the groundwork for that. And I think there's real opportunity here to find different funding streams that we can use so that not only can we support the CHWs that we have, but really expand to have a much more robust workforce throughout the state. So with all that said, I'm going to turn it over to, I think it's Commissioner Lee, who's maybe going to share first about some of the work being done. And then Dr. White, if you have anything you want to add.
Well, thank you, Emily. So yeah, as you said, community health workers are definitely a very important part of our healthcare landscape. And we have been trying for some time to figure out how we can make them sustainable. So I think that we have a couple of things going on here in the cabinet. You mentioned the grants that the Department for Public Health has received. I am involved in a Medicaid Leadership Institute, and part of my project in that work group, or in that group, is how to make the community health workers program sustainable. And as you said, Emily, it's not very easy with, it's easier said than done, just saying, Medicaid will fund it. So what I was really excited when I learned about the grant at DPH, because I think that gives us an opportunity to work together and get this assistance from the national level on what other states are doing and what we can do as far as sustainability for the CHW program. One thing that we want to explore and look at is how can we do that without increasing the Medicaid state general fund dollars? For example, are there community partners, hospitals, other organizations that can put up that state match and help draw down those federal funds to make these programs sustainable? So that's some things that we're going to look at as we go forward. And again, I'm very excited to be sitting in with public health as they discuss their plans for the grant funding that they have received. So as far as the Medicaid program goes, that's one thing we're going to do is just see how we can partner and get those additional state general fund dollars from another source. Because, for example, we do contract and we do work with their school-based health services. So our school-based health services put up the state match for funding, and then they're able to draw down those federal dollars in order to increase their funding for the services that they provide. And we'd like to see something like that for the community health workers on a broader level. So with that, I think I'll turn it over to Dr. White and let her fill in some of the other opportunities and things that they're doing with the grant funds.
Thanks, Commissioner Lee. Yes, we've been working with a large work group, a statewide work group on community health workers since I believe 2015. We've developed certification now, so the Department for Public Health does certify. And I think we have some CHWs on this call. We've then been able to take the funding that we've gotten through COVID funding. Our Office of Health Equity has gotten some money to use community health workers to help with COVID information, to try to block the misinformation. We've gotten some funding in one of our grants to the immunization branch is to make sure that vaccinations are being offered in the communities of color and of those that are disabled and vulnerable. And then our own department, our Office of Community Health Workers in our Division of Prevention Quality Improvement had an opportunity for funding. So what we did was, and I know this sounds surprising to many of you, but the three of the principals sat down together in a big room and said, okay, you got money for this and you got money for this and I got some money for this, and how can we make sure that we're all talking to each other? So the funding that we got in the Department for Public Health, we are working with the Kentucky Primary Care Association to work on putting some community health workers into some primary, some of the either FQHCs or RHCs, but a big chunk of that funding is working on training. So we're able to take our piece of our money to work on training so we can be sure that we have enough CHWs trained for those other two grants to make sure that we're able to fulfill the grant deliverables for information, vaccination, and whatever other services that people need, either for vaccination or treatment for COVID, or just the basic information for people to know about mitigation techniques. So we've been able to really do a nice dance of blending all of that together, and real appreciative of Commissioner Lee continuing this conversation. So we're very excited about that.
Yeah, I think that this opportunity and the collaboration between the Department for Public Health and Medicaid is just really fantastic. And it's something that we've been waiting on for a long time to really see what the potential that we have here in Kentucky to have a stronger, more robust community health worker workforce. And so it's exciting that these funds are available. Can you tell us a little bit more about this work being done around vaccines? I know that there's been some training on vaccine confidence, and that CHWs are, having a lot of those conversations in their communities. Is this something that you're kind of anticipating will be kind of a long-term role for CHWs to not only talk about COVID-19 vaccines, but also the importance of vaccination generally, because we've seen that there's unfortunately been a decrease across the board?
Absolutely. One of the things that we help Kayak, and if you don't know who Kayak is, it's the Kentucky Association of Community Health Worker. That is an advocacy group that is operated by community health workers. And so we work with them to provide continuing education. So we have, over the last 18, 19 months, tried to be sure that we gave as much information to our community health workers so they could share that information with people. I'm trying to back away from the word education education. Most of us get a little, our haunches up when somebody says they're going, somebody's going to educate me. It's like, I feel pretty educated, but I'm not very well informed. So I think, again, words matter. So we're trying to inform people. We want our community health workers to have all the right information because they are that trusted person that looks like them, that sounds like them. And then when they share that, they have the right information to share. So we're having lots of virtual webinars on this, a lot of testimonials and examples, because I always learn better by hearing a story. And I think community health workers communicate well by storytelling. So we're trying to be sure that they are the most informed person on the block, because we think that they are that trusted individual.
Yeah, thank you. I think something that has become clear during the pandemic, I mentioned, just the basic needs that people have. And sometimes, what we've seen, at least at Kentucky Voices for Health, even though people desperately need, of course, health care and health insurance during a pandemic, we did a pretty good job of that. We actually had most people covered, which was amazing. And compared to other states, we had more people insured and able to access the care that they needed. That wasn't the most urgent need that people had during the pandemic, which, is a little surprising when you think of it as a public health crisis. But people did have urgent need for food and housing. So do you see a role with these grants and with, the work that you're doing to expand the CHW network, like having a big emphasis on other basic needs like food and housing, transportation?
Yeah, absolutely. One of the big partners we have a weekly vaccine equity work group that meets, and it's people from all across the cabinet and from outside the cabinet. But we've really worked a lot with the commissioner from Dale, Department of Aging and Independent Living, and been able to get that shot of hope at home that she has developed in Dale. And I think that has also made some great connections as we look at working with food banks, having vaccination clinics at food banks, making sure that food banks not only do food, but they also have food for people with diabetes, for people with hypertension, and make sure there's you don't want to give somebody with hypertension a whole box of Campbell's soup, like I fed my mother last week. Sorry, she had an upset stomach. But, that's not usually what I want her to eat because of all the salt content, but to make sure that we are meeting people where they need to be. And so make sure not only we're giving them food, but we're giving them food that works for them, making sure we don't tell you need a vaccination, but it's that, do you have a ride? Do you need help getting there? Are you having problems? Are you on home oxygen, but you're 2 months behind on your electric bill? Those are things that somebody sitting in your home and looking at you eyeball to eyeball can give you a much greater degree of help. And then for Commissioner Lee, it's when that community health worker finds out that the reason you've been in the hospital 3 times this last year is because of renal failure, because you didn't have a ride to your dialysis. That community health worker makes her yearly salary by keeping Commissioner Lee from having to pay for a week hospitalization for somebody in DKA. So all of those dots are being connected, and it's very exciting.
Yeah, and speaking of transportation, maybe more a comment than a question, but we know that non-emergency medical transportation is a really important benefit in the Medicaid program. Also, one that is underutilized because it's complicated for people to access. And I think it's unclear to us whether people aren't eligible for NEMT or if they're just not able to provide the documentation or, kind of go through the application process with their local vendor. But I really hope that CHWs can kind of help to be the liaison there as well and broker that so that more people have access to the transportation that they need. I think that's a real opportunity.
I always felt if we could buy everybody in Kentucky a car that ran, we would suddenly have a healthier state, because part of the reason people aren't healthy is they just can't get to the doctor. They can't get to the pharmacy to get their medicine. They can't get to, and they don't know how to access available resources.
Well, it looks like we're close to time, but is there anything else that you all wanted to share with us related to the work that you're doing on CHWs? All right, well, we really appreciate your time today. And Kelly, can you bring up the last couple of slides? Just want to remind everyone that if you are a certified community health worker, or if you're a licensed social worker, you can get CEUs for participating today. Just email Kelly. We also will be sending out the slide deck, the recording, any other information, responses to the questions that were put in the chat. And then here's our contact information. And of course, this will be in the slide deck that you receive. So thank you everyone for attending today. We appreciate it. And we'll look forward to seeing you in December. Our next monthly update is, I want to say December 2nd, but Kelly, I'm not sure. No, it's not. December 7th. Thank you. That's right. It's this one of those months where the Tuesday comes kind of later. So December 7th at 2 p.m. Thanks very much. Have a good afternoon.